Following from that basic pelvic floor support that we've talked about in earlier videos, some activities that are a little bit more challenging require a bit of an extra level of bracing. And I tend to call this side support or oblique support or something like that. I'll make it clear in the videos which exercises tend to need this extra level of stabilization, and certainly when you come work in clinic, it will be made clear to you. But for some exercises, it's valuable to think of both the pelvic floor support, that feeling of, you know, if you use the muscles that would stop the flow of urine if you were midstream. But then on top of that, it's also important and valuable in some cases to utilize these muscles here on the side of the abdomen. So the easiest way to feel these muscles is to press your fingers into the sides of the abdomen and then just cough. Yeah, and you instantly, if you just put the fingers in there and cough, they really kick in. They're very, very big, powerful muscles. And if you, for really challenging movements and exercises that require quite a lot of stabilization, you can combine that feeling of pelvic floor coming in and up with a bit of bracing from these side muscles together. And that's a really, really optimal way to support and stabilize and protect the spine. Now, it's really important to remember that this doesn't need to be engaged for simple and easy movements. So if you're thinking, you know, brace to just, you know, bend forward to tie your shoelaces or pick a pencil off the floor, that's probably overdoing it. And that can lead to issues in itself of overprotection and oversupport. But if you're doing something like lifting a heavy kettlebell or doing a barbell squat or a deadlift or some big, heavy gym-based exercise, or even something in life like lifting a sofa, helping a friend move house, this level of support can be really valuable to protect and stabilize the spine when doing difficult movements.